So, Robert, how does disclosure and apology relate to malpractice in dentistry?
Well, when we look at the malpractice environment in general, we know that a lack of disclosure, a lack of candor, failing to apologize, has a direct impact on the frequency and severity of claims, and it's a problem in dentistry. It's a problem in healthcare in general, but our dental claim evaluation shows that it's a big deal for us as far as being a driver of malpractice claims. And if you look at malpractice in general, we're seeing a severity trend. So in the mid 90s or late 90s, average dental malpractice claim was around $19,000. That had gone up to $39,000 by the mid 2000s and is now in excess of $100,000. And in working through our dental claim evaluation, we see failure to disclose, failure to apologize, failure to be honest and candid coming up over and over again as a claim driver. So definitely a problem for us in dentistry from a malpractice perspective.
Why is it such a topic of conversation right now?
It's been a topic of conversation for about the last decade in healthcare in general. What we see is that for so long, for time eternal in medical professional liability, monetary and litigation concerns kept us from being honest and candid and forthright when something went wrong. I think that we always knew that disclosure and apology in most instances was something that was morally and ethically the right thing to do, but concerns about claims or concerns about higher dollar values of claims kept us from crossing that threshold. And we've realized in recent years that there's a movement toward disclosure and apology in the country, and that it's the right thing to do. And so that's kind of the direction that we've been heading. We look at disclosure and apology as a proactive, patient-centered approach. Basically, timely and meaningful disclosure when something has gone wrong is the right thing to do and the right way to approach a situation if you have an adverse outcome.
So can you give me some reasons why disclosure and apology is, even needed in dentistry?
Yeah, it's needed and it's necessary because patients expect it. It's the right thing to do, morally and ethically. If something has gone wrong or if you've come across something unanticipated, being honest and candid and up front about that is necessary. What we find is that when you have full disclosure if something has gone wrong, you get a situation where you preserve patient trust. You have the ability to continue to have a relationship with the patient, which is huge. It allows you to move on to what's next. It allows you to start to fix, clinically what happened. If you haven't had a discussion about what went wrong, there's no way that we can move on to fixing it. And so that candid nature of discussion and disclosure is required. Patients expect it, patients demand it, and it allows us to move forward clinically, and it also allows the healing process to start, not only for the patients, but also for the dentist. I mean, no one wants something bad to happen. And what we find is that once you've been honest and once you've disclosed a scenario, it allows everybody to start healing. So we find that patients and families hire attorneys for two reasons: either to get information or to basically to get back because of feelings of betrayal or mistrust. And we know that you can avoid both of those scenarios by having a good, solid disclosure process in your practice. And then there's also the financial reasons for disclosure. So I mentioned earlier that the thought process for Time Eternal was that if we're honest, if we apologize, it's going to cost more money or it's going to initiate claims. And what we found is that just the opposite is true. There have been a number of studies and a number of entities that have implemented a disclosure and apology process that has led to significant cost savings. The University of Michigan, for example, implemented a disclosure and apology process as opposed to a deny and defend mentality. And what they found is that their number of lawsuits dropped significantly. The cost of the lawsuits that they did have dropped significantly. The same thing with the Stanford University Pearls program, moving from deny and defend to being honest and candid and upfront. And they found the same thing, that lawsuits were reduced significantly. Some of the numbers as much as 50% lower after implementing this program.
Wow.
So it's the right thing to do, and morally and ethically, we always knew it. The concern was monetary. We find that that monetarily, it's also the right thing to do.
Can you give a couple case examples on this topic?
Sure, like all of our examples, we could probably give 50 on each topic, but a couple of pointed examples specifically about apology. So one, we had a pediatric dentist, Dr. C, who received a referral from an orthodontist to remove a deciduous tooth. And unfortunately, this happens from time to time. It was a busy day at the practice. Dr. C went in to remove this deciduous tooth and accidentally removed a permanent tooth that was adjacent. So this is a scenario where it was recognized immediately, and the disclosure process should have happened immediately. But understandably, Dr. C was extremely upset. And he went about it the wrong way. As opposed to talking with the family, he allowed the family and the patient to leave. They had no idea that the wrong tooth had been removed. And then the doctor got in touch with the orthodontist and started having a discussion about the documentation and the request for which tooth was supposed to be removed. So there's a little bit of jousting going on in here. But yeah, they were. There was a scenario where there should have been a discussion. The discussion didn't happen. The orthodontist was made aware of the scenario, and the orthodontist, and rightly so, it was her patient also, had a discussion with the patient and told them what had happened. By the time Dr. C tried to get back in touch with the patient, it was too late. That was a discussion that needed to happen immediately. It's a difficult conversation to have. It is the reason why we suggest having a policy and procedure and planning ahead for the circumstance in which you might have an adverse outcome. You need to be ready ahead of time. You don't need to be trying to plan this type of conversation or figuring out how you want to go about the disclosure process after something bad has happened. It's a pre-planning. And then another case example that we have more on the positive side, where apology and disclosure was used effectively. We had a patient that was in for an implant after some sort of sports injury, had a tooth knocked out. So the patient was in for an implant. They were working through this process, and the doctor inadvertently pushed through the floor of the sinus and into the sinus cavity. So they immediately halted the procedure, and remedial measures were taken to seal the perforation and get the site prepared for future restoration. So the doctor and the office manager called the patient's father and the patient into the office, and they sat down and had an immediate conversation about what had occurred. Informed consent comes into play in this particular case example also, because there had been an informed consent process and the potential of a sinus perforation was mentioned. So it wasn't something that was coming completely out of the blue for this particular patient. So the doctor was honest, upfront, and empathetic with the patient and the patient's father, and expressed a desire to not only to continue care, but treatment plan as to how to come back in and finish the implant procedure once the perforation had healed, and also to cover the cost for the perforation. So the patient and the patient's father, they weren't happy about the scenario, but because of the way that it was handled, they continued to treat with the doctor, and no lawsuit was filed. So this is one of those scenarios where everything worked out well, and I think it's due in large part to the candid, upfront, forthright nature of the approach to the situation, even after something had gone bad.
Right. And I understand you have a recipe for a lawsuit?
Yes, my Robert Thompson's recipe for a lawsuit. These are the things not to do. So after an unanticipated outcome or error, avoid the patient, hope it will go away, blame others, or jousting, which we've talked about in some of our other programs, refuse to answer questions, refuse to apologize, refuse to let the patient vent, and send your bill as usual. So I know that there's a little bit of a comical nature to it, but you would be shocked how often this is exactly the recipe that is followed when something goes wrong, because it's the easy thing to do. Again, pre-planning, policy and procedure, understanding what you're going to do before something happens is the best way to approach it.
So what's the best way for a dentist to go about the disclosure process?
I think the first thing is to understand what a patient wants from the disclosure process. So the first thing they want is an acknowledgement of the event. They want to know what happened. They want an explanation as to what occurred. They want an apology, and they want a plan going forward. And then lastly, they want assurances that what happened to them isn't going to happen to someone else. They want to make sure that if there was some sort of error, that you're doing something to fix that error, to make sure that it doesn't happen again. So what you need to do to get through this process is to understand that those are the things that the patient wants, and then to work through the process of disclosing. So make it timely. In dentistry, that means almost immediately. You pull the wrong tooth, you recognize you pulled the wrong tooth, we need to have a discussion now. It's not something where we need to figure out what happened. So in dentistry, the timeliness of this tends to be immediate. Be upfront and honest, but don't speculate. So just the facts. Patients will attempt to get you to speculate. Stick to your guns as far as just the facts. Don't speculate or guess. Verbalize a commitment to ongoing care. Keeping the patient with you and keeping the care plan moving forward is one of the ways that we see makes it way more difficult for a patient to file a lawsuit.
Yeah.
Don't be afraid to apologize. And this is where it gets a little tricky. There's two types of apology. There's apology of regret, which says, I'm sorry you're going through this. And you should always be willing to give an apology of regret. There's also an apology of remorse, and that's a little more tricky. Apology of remorse says, I'm sorry that I did something wrong. I'm sorry that I messed up. That's a little, you need to be a little better planned out. Call your risk management folks. Call your malpractice carrier and get some advice before you make that type of apology. But sometimes it's appropriate too, because you have nothing to lose. I mean, if you pulled the wrong tooth, I'm sorry that I messed up and pulled the wrong tooth may be the right thing to say. Document the disclosure conversation, the plan, and the patient's response to it, and then make sure that you're continuing to follow up with your patient going forward. It becomes easy to be quiet. It becomes easy to ignore the patient. Refer back to my recipe for a lawsuit. You've got to keep the conversation going even though it's uncomfortable. And recognize that you're going to get through this on the backside, and that if you've followed the process correctly, it can work out in your favor and in the patient's favor.